Cellulitis is an infection of the skin, specifically the dermis and subcutaneous tissues, usually following a break in the skin, such as infected wound or prick by a pin, nail, thorn, insect bite, or cracks between the toes from athlete's foot. It may affect any part of the body, but it affects the legs mostly. Obesity and leg swelling are risk factors, and it's important to rule out acute osteomyelitis, necrotizing fasciitis, and deep vein thrombosis. The causes are Streptococcus pyogenes, that's the commonest cause, and Staphylococcus aureus. And the symptoms are pain over affected area, swelling of the affected parts, reddening or darkening of the overlying skin, blistering, ulcers, fever, rigors, malaise, vomiting, confusion. The symptoms are usually elicited as swelling of the affected parts, blisters, localized tenderness and skin change, color change, localized warm, ulcer including the web spaces, enlarged and tender regional lymph nodes, underlying pus, an offensive wound, and also fever. Investigations are FBC, ESR, CRP, blood culture, fasting blood glucose, gram stain and culture of discharge, and X-ray of affected parts. Main treatment objectives are to relieve pain, to control and eradicate the infection, to treat predisposing conditions, and to prevent complications like ulceration and osteomyelitis. Non-pharmacological treatments rest and elevate the affected part if possible. You clean and dress any open wounds. Incision and drainage if pus forms. Debridement, as well as splint, skin graft if indicated. Pharmacological treatment for pain relief, you treat appropriately. Antibiotic therapy for individuals stable enough to be treated as outpatients. First line treatment, you give amoxicillin oral in adults 500 milligrams to 1 gram 8 hourly for 7 days. In children 6 to 12 years, give 250 milligrams 8 hourly for 7 days. And 1 to 5 years, give 125 milligrams 8 hourly for 7 days, and less than 1 year, give 62.5 milligrams 8 hourly for 7 days. Also, you give flucloxacillin oral in adults 500 milligrams 6 hourly for 7 days. In children more than 10 years, you give 250 to 500 milligrams 6 hourly for 7 days. And 2 to 10 years, give 125 to 250 milligrams 6 hourly for 7 days. Less than 2 years, give 62.5 to 125 milligrams 6 hourly for 7 days. A second line treatment, they give amoxiclav oral in adults 625 milligrams 8 to 12 hourly for 5 to 7 days. In children 11 to 18 years, we give 625 milligrams 8 to 12 hourly for 5 to 7 days. And 6 to 10 years, we give 457 milligrams 8 to 12 hourly for 5 to 7 days. And 1 to 5 years, we give 228 milligrams 8 to 12 hourly for 5 to 7 days. And less than 1 year, give 114 milligrams 8 to 12 hourly for 5 to 7 days. For individuals with penicillin allergy, give erythromycin oral in adults 250 to 500 milligrams 6 hourly for 7 days. In children 8 to 18 years, give 250 to 500 milligrams 6 hourly for 7 days. 2 to 7 years, give 250 milligrams 6 hourly for 7 days. And less than 2 years, give 125 milligrams 6 hourly for 7 days. Or you can give clindamycin oral in adults 150 to 300 milligrams 6 to 8 hourly for 7 days. And in children 12 to 18 years, give 150 to 300 milligrams 6 hourly for 7 days. 1 month to 11 years, you give 3 to 6 milligrams per kilogram 6 hourly for 7 days. Antibiotic therapy for patients who require admission. First line treatment, give amoxicillin clavulanic acid IV in adults 1.2 grams 12 hourly. In children, that's in adults, is increased to 1.2 grams 8 hourly in severe infections. But in children 12 to 18 years, give 600 milligrams to 1.2 gram 12 hourly, and is increased to 1.2 gram 8 hourly in severe infections. 3 months to 12 years, give 30 milligrams per kilogram 12 hourly. Is increased to 30 milligrams per kilogram 8 hourly in severe infections. 7 days to 3 months, 30 milligrams per kilogram 8 hourly, and preterm and less than 7 days, give 30 milligrams per kilogram 12 hourly. And then you give amoxicillin clavulanic acid oral in adults 1 gram 12 hourly. In children more than 12 years, you give 125 milligrams 12 hourly. And 4 to 12 years, you give 5 milliliters of 457 milligrams suspension 12 hourly. And 1 to 4 years, you give 5 milliliters of 228 milligrams suspension 12 hourly. And 3 months to 1 year, you give 20 milligrams per kilogram of amoxicillin 12 hourly. Less than 3 months, you give 15 milligrams per kilogram of amoxicillin 12 hourly. And then you give clozapine IV in adults 500 milligrams 6 hourly. In children 5 to 12 years, give 250 milligrams 6 hourly. And 1 to 5 years, give 125 milligrams 6 hourly. Less than 1 year, give 62.5 milligrams 6 hourly. Then you give flucloxacillin oral in adults 500 milligrams 6 hourly. In children 5 to 12 years, give 250 milligrams 6 hourly. 1 to 5 years, give 125 milligrams 6 hourly. And less than 1 year, give 62.5 milligrams 6 hourly. Second line treatment, give amoxicillin clavulanic acid IV in adults 1.2 gram 12 hourly. Is increased to 1.2 gram 8 hourly in severe infections. In children 12 to 18 years, give 600 milligrams to 1.2 gram 12 hourly, and is increased to 1.2 gram 8 hourly in severe infections. And 3 months to 12 years, if 30 milligrams per kilogram 12 hourly, is increased to 30 milligrams per kilogram 8 hourly in severe infections. 7 days to 3 months, if 30 milligrams per kilogram 8 hourly. Preterm and less than 7 days, give 30 milligrams per kilogram 12 hourly. And then you give amoxicillin clavulanic acid oral. That's after IV. You give oral 1 gram 12 hourly. In children more than 12 years, we give 125 milligrams 12 hourly. 4 to 12 years, give 5 milliliters of 457 milligrams suspension 12 hourly. 1 to 4 years, give 5 milliliters of 228 milligrams suspension 12 hourly. 3 months to 1 year, give 20 milligrams per kilogram of amoxicillin 12 hourly. And less than 3 months, give 50 milligrams per kilogram of amoxicillin 12 hourly. Then you give clindamycin IV in adults 300 milligrams 6 hourly for 600 milligrams 8 hourly, and children 3 to 6 milligrams per kilogram 6 hourly. Then clindamycin oral in adults 150 to 300 milligrams 6 to 8 hourly. In children 12 to 18 years, give 150 to 300 milligrams 6 hourly. 1 month to 11 years, give 3 to 6 milligrams per kilogram 6 hourly. For methicillin resistant staph aureus, give vancomycin IV 1 gram 12 hourly over slow infusion over 1 hour, the maximum of 2 grams daily. For children 1 month to 12 years, give 10 milligrams per kilogram per day in divided doses, 6 to 12 hourly, with a maximum of 1 gram daily. Referral criteria: you refer all cases with treatment failure, complications, or ulceration requiring debridement and grafting to a plastic or general surgeon.